Chandra here with us as a guest speaker. Dr. Mekla is MBBS MD Senior Consultant Internal Medicine. She has done her fellowship in obesity medicine and is also a certified practitioner from American Board of Obesity. With over 8+ years of experience, Dr. Mekla is an expert and specialist treating weight-related issues and other lifestyle-related disorders. So I request Dr. Mekla to take over the sessions and start the webinar. Thank you so much.
Thank you so much, Sanjita, for such a kind introduction. Hi, everyone. Today, we are going to talk a little bit about weight management. And today we'll know कि exactly weight management है क्या, उसमें obesity, underweight, malnourishment सब आता है. So basically, weight management is a whole long-term process where there's a modification of behaviors. It involves your physiological processes, यानी कि आपकी underlying conditions, आपकी body कैसे affect कर रही है इस चीज को, and how it affects the person's ability to maintain a healthy weight. These are all long-term techniques and mainly lifestyle strategies इसमें promote करी जाती हैं ताकि आप ultimately healthy eating and daily physical activity को अपने behavior में लाएं. So let's understand the basic science of weight management. So maintaining a healthy weight is very important. And why is it? Because as we know, we know more about obesity, but this can be same with underlying undernutrition or malnutrition. They can lead to development of chronic diseases. Obesity is more linked to type 2 diabetes, high blood pressure, and cardiovascular disease. Okay, so rightfully so, we are all struggling with obesity, and because WHO ने जो data gather किया था in 2022, they have estimated that 49% of the world population is overweight, and almost 13% of them are obese, which is a huge number. And in scientific terminology, it has reached the definition of a pandemic. So obesity is one of the most neglected public health problems, even more applicable in India, and we'll see why. So according to Global Burden of Disease, almost 5 million people died prematurely in 2019 just due to obesity. And this number, the worldwide number, has doubled in 2019 to what it was in 1990. अब अगर हम इंडिया की बात करें तो India has the world's fastest growing obesity rate in the world, which has been estimated to more than 135 million people who are struggling with obesity in India currently. देन एक नेशनल फैमिली हेल्थ सर्वे 5 हुआ था, उसका डेटा कंपाइल करके उनको पता चला कि देयर इज 1 in every 4 people who are overweight compared to 1 in every 5 earlier. So if you look at this graph, it will show you that by 2030, 28% of all overweight people in the world would actually be Indians. And this is the data that is represented here in the graph. And you can see कि जो age group है वो 20 to 40 years of age group में ज़्यादातर आपको दिख रहा है. However, it's affecting children also. So we terminology जो हम use करते हैं उसको हम childhood obesity कहते हैं. And you can see कि that graph is also rising. So it's estimated that 1 in 10 obese children throughout the globe will be from India by 2030. Now, talking about the reasons for obesity in India, कि अचानक से इंडिया में, especially in the last decade, obesity क्यों बढ़ी है? It's one of the main causes that the data has gathered is drastic changes in food habits. So easily available जो processed food and junk food है, as you can see in your stores, the central aisle, it's a little bit of education here. जो आपकी central aisle होती है, that is more of like preservative food and processed food. That's why it stays longer on the shelf life. And अगर आपका जो side का aisles होता है, which is more refrigerated, that is more fresh food. So when you're shopping, be aware of that and try to shop from the more fresh side of the food availability. Then other causes we saw is sedentary lifestyle. अचानक से सब laptop में people are changing their sleep habits, so lack of sleep is another common factor. And then misconceptions in parenting is a huge factor that has led to the rising obesity. So especially in Indian parenting, the wrong eating habits are promoted even in childhood. Then stress, and definitely the lockdown did not help. And then if we see the correlation just between age and obesity, we can see that 7% of young men between 15 to 19 were obese, which is a huge number for that age group. And 32% of men between 40 to 50 were overweight. And the same number exists for women. तो अगर आप इस ग्राफ में देखेंगे, you can see that 73% of urban Indians are overweight and almost half of these are obese, and maximum risk age group जो है वो 28 to 38 years of age में है. And they did a state-wise analysis of obesity in India also, and you can see that the highest ratio of obesity was found in Delhi, Tamil Nadu, and followed by Kerala. Similar for women is Pondicherry, Chandigarh, and New Delhi. So now let's talk about what exactly is obesity. So the obesity, the basic concept is the same. अगर आपका intake and output में difference होता है, so if intake is higher than the output, then you will have weight gain. If your intake of calories and output of burning calories is the same, then you'll have a stable weight. And if your intake is less and your output of burning calories is higher, then it's weight loss. So it's a very, very simple concept. So before we go ahead, how it affects and how we can address this, let's understand what obesity exactly is in terms of scientific language. So जो obesity medical association है, उसने इसको define किया as a chronic disease. So please note it's a chronic. That means that nothing happens overnight. And it's progressive disease. It involves your different system. It's a neurobehavioral disease, यानी कि आपके emotions, mental health इसमें सब में contribute करती है. And ultimately it leads to increase in body fat, which promotes the dysfunction in your body. And WHO gave a more simplified definition of it. It defines obesity as an excessive body fat accumulation, which is associated with several risks to health. And coming to the third definition of obesity that we commonly know as in terms of BMI, जो हम लोग आम उसमें जानते हैं, तो we know the normal weight BMI is between 18.5 to 25, and anything above 30 cut off will become obesity, जिसको इन्होंने divide किया obesity class 1, 2, and 3 में. So a little data about BMI. So BMI is not the most accurate indicator for obesity. It's not a very accurate measurement because mainly it doesn't take the body composition, that is your fat-free mass, your adipose tissue, yeah, usko account mein nahi leta. And so having said that, it's still a very important indicator because above 18.5, it is associated with cardiovascular and metabolic diseases. So coming to after BMI, what we really use in medical terminology is something called as percentage body fat. और उसकी classification आप यहाँ देख सकते हो. तो above women for 32% and men for 25% is classified as obesity. And इसकी measurement थोड़ी सी specialized machine से होती है. So you may have it at a doctor's office or some specialized clinic. So in short, what is BMI classifying as? If your BMI is above 30, sorry, in short, what is obesity classifying as is if your BMI is more than 30, your body percentage fat is more than 32% for women or 25% for men. And the other thing we look at is the waist circumference, which is in terms of inches for women more than 35 and men more than. Okay, so now coming to what is central obesity, which is very important for us as an Indian population to know. So central obesity को दो parts में divide किया, which is central fat accumulation, which is more representative of your visceral fat. And what exactly is visceral fat? हम लोग थोड़ी देर में discuss करेंगे उसे. The other one is divided into what we call as abdominal obesity या truncal obesity. So for men, it's more of abdominal obesity, या जिसे हम apple shaped कहते हैं. And for women, it's more of truncal obesity, जिसे हम pear shaped कहते हैं, which is more of lower body fat accumulation. So the central fat accumulation has been linked to more of the cardiovascular risk factors. And इसका भी clinical criteria होता है. So waist circumference हम measure करते हैं. And as I mentioned earlier, for men, it's more than 40 inches. And for women, it's more than 35 inches in Indian population. And then we also measure the hip circumference. So ultimately, waist to hip ratio calculate होता है, which is more than 0.9 in men and 0.85 in women. And that basically gives you more of a health risk assessment. So a lot of my patients will come and they'll say कि मेरा normal BMI है, but I still have this central paunch around, and what is my risk factor. We'll also see कि आजकल young generation में बहुत लोगों को, even though they look healthy, they may develop diabetes या high blood pressure diagnosed हो रहा है. And that is again coming to the point कि when we measure, we don't measure BMI, we actually measure the waist to hip ratio, जिसमें आपकी वेस्ट सर्कमफ्रेंस अगेन रिप्रेजेंट करती है विसरल फैट. Now, what exactly is visceral fat? It is mainly the fat that is deposited आपके organs में, so like heart, liver, or intestine या gut हो गया आपका. So these all lead to the more risk factors of cardiovascular disease, and how we'll just see it in the near future. So normal weight obesity जो है उसको define किया जाता है जब आपका BMI normal आ रहा है, but आपका high body fat percentage आ रहा है, and that is more than 20% in men and more than 33% in women. So basically, the definition of this is excessive body fat accumulation despite a healthy body weight. And this has been described as normal weight obesity syndrome. And it's a condition in which individuals will have the normal body weight, but increase fat percentage. And individual more than 20 years of age with this kind of obesity has up to 4 times likelihood of developing metabolic syndrome. So again, to answer your questions, a lot of normal BMI people coming, developing diabetes and high blood pressure is equally and appropriately represented by this data. Okay, so now we'll talk about visceral fat, यानी कि जो fat आपकी organs पे deposit होता है, fat you can't see, not the fat that you can feel outside, like the paunch you feel. So जैसे कि आप इस figure में देखोगे, that's your normal heart, and you can see how healthy it looks. And the visceral fat deposition looks something like that, which you can imagine कि जो आपका heart है, जब वो beat कर रहा होगा, तो उसकी muscle stretch करने में कितनी problem होगी. अंदर जो हम plaques के नाम से जानते हैं, उसमें these are all risk factors जिससे आपको future में heart attack भी हो सकता है. Similarly, this is a diagram of your gut. A healthy gut looks like this, an intestine. And with the fat deposition, again, this is how it will look. And this kind of visceral fat, जिसे हम medical language में बोलते हैं, that is the increasing risk factor for these diseases. So let's figure out कि understanding of obesity as a disease क्या है. So you can see here कि obesity जो है, it can cause cholesterol problems, it can increase your cancer risk, and these are all interrelated, so vice versa. अगर किसी को type 2 diabetes है, so they are at increased risk of having obesity, and vice versa कि obesity जिनको होती है, उसमें से बहुत सारे लोगों को type 2 diabetes भी हो सकती है. Similarly, liver disease जैसे हम fatty liver disease का नाम जानते हैं, या heart problems. Again, obesity can lead to different mood disorders. क्योंकि बहुत लोगों को बॉडी डिस्मॉर्फिक सिंड्रोम हो जाता है, उनको अपनी फिजिकल अपीयरेंस में दे टेक इट एज स्ट्रेसफुल, बट द अदर वे अराउंड, जैसे डिप्रेशन होता है, एंजाइटी होता है, दीज मूड डिसऑर्डर्स कैन कॉज ओबेसिटी. So as I said earlier, obesity is a multifactorial disease. उसमें आपके genetics involved हैं. There's a lot of social and cultural involvement कि how you eat as a family, what you believe in as a family, as an individual. Of course, there's hormones involved, there's medical problems and mental health issues involved. And इसकी inheritance भी multifactorial होती है. So when we as physicians किसी भी पेशेंट को देखते हैं, तो पूरी फैमिली हिस्ट्री जानना बहुत जरूरी होता है कि किसको, मदर को है, फादर को क्या क्या डिजीजेस हैं, बिकॉज दिस ऑब्वियसली a genetic inheritance, and that's why we as Asian Indian population have a higher risk of developing obesity. Having said that, there's a lot of extra genetic causes also, so you can't blame everything just on the genes. So that also includes your family, कि आप as a family क्या खा रहे हो, कितने बजे खा रहे हो, आपकी टेबल पे क्या फूड है, आपकी पैंट्री में क्या क्या स्नैक्स हैं, क्या जंक फूड है, और फ्रीजर में क्या प्रोसेस फूड है. Then also geographical location. So whether you're in a coastal area, whether you're like in a landlocked area, what exactly are you eating, these things also ultimately matter. Lack of optimal nutrition and physical activity. So people more from urban areas have sedentary lifestyles. The disturbed sleep, so poor quality, बहुत कम सोना है, बहुत ज़्यादा सोना है, ये सारे contribute करते हैं आपकी obesity में. Very important point is medication. So people don't realize the medication they're on, and a very common example of that is steroids, can also affect your weight gain. Mental stress, so a lot of people do emotional eating, they do anxiety eating, night eating syndrome, ये सारा mental stress की वजह से होता है. And then coming to neurological dysfunctions, so people who've had some kind of nervous system trauma, for example, this can also lead to increased weight gain or decreased weight gain. Certain viral infections, and last but not the least is something called as gut microbiota, जिसको आप आजकल जान रहे होंगे कि probiotics, prebiotics, ये सारा gut reset में help कर रहा है. So let's take a quick look at what happens inside the body actually. सो इनसाइड द बॉडी ये जो है आप देख सकते हो ये एडिपोस टिश्यू है. नाउ साइंटिफिकली देयर ओन इंडिपेंडेंट यूनिट ऑफ हार्मोन्स. सो दे डू रिलीज सर्टेन हार्मोन्स नोन एज एडिपोनेक्टिन, रेसिस्टिन, लेप्टिन. एंड ओबीज एडिपोस टिश्यू जैसे कि आप देख सकते हो कि वेट गेन में दीज स्ट्रेच एंड अल्टीमेटली दे रिलीज इन्फ्लेमेटरी मॉलिक्यूल्स. सो अगर सिंप्लीफाइंग इट, सो जो एंडोक्रिन एंड इम्यून रिस्पॉन्सेज होते हैं उसकी वजह से आपको एलिवेटेड ब्लड ग्लूकोज दिख सकती है, elevated blood pressure, cholesterol problems, and other metabolic disease. In short, they can all increase your risk for developing diabetes and heart problems. Then something called as fat mass disease कि आपका overweight है या obesity है, तो they're causing structural या biomechanical problems. So बहुत लोग जो होते हैं with unhealthy weight, उनमें आप देख सकते हो कि knees में problem है, उनको joint pains है, back pain है, they can't move that well. And something which is not easily identified is sleep apnea. जैसे कि आप बहुत ज़्यादा सुनोगे कि लोग snoring कर रहे हैं, there's a lot of like reflux, acidity, ये सारे mechanical pressures की problems हैं. Then stress response is another thing जो fight and flight और submit and stay के नाम से हम लोग जानते हैं. तो initially जो fight and flight होता है आपका उसमें glucose increase होता है, which is what is needed for you to fight and fly. But chronic stress में जो आजकल हम सभी रहते हैं उससे आपकी जो long term stress hormone होती है cortisol, that is constantly elevated, again increasing your glucose levels and BP, and they also increase your food cravings. So you'll see on a very stressful day आपको कुछ craving होगी particular food की, and that probably is the unhealthy food craving for you. Immune system plays a huge role, especially after COVID. We have found कि chronic inflammation जो stage है body में, that increases your certain hormones and inflammatory markers, which can lead to obesity. So this is a very classic example of obesity and stress cycle, जो कि एक vicious cycle है कि आप पहले acute stress में होते हैं, फिर उससे chronic stress stage में जाती है, behavior changes होती हैं, hormonal changes होती है, immunology change होती है, and ultimately it increases body fat. So there's something called as obesity paradox, क्योंकि आप बहुत लोगों से मिलोगे and they'll say कि for example, are some races paradoxically at increased risk for metabolic disease for the same amount of body weight? Does a decrease in fat mass always improves in metabolic disease? I think a lot of my patients actually ask that, ki, is it really important to be slim and trim? But the truth is ki these paradoxes will always exist. But having said that, obesity increases morbidity and mortality, and ये बहुत सारी studies में already proof हो चुका है. So obesity paradoxes are less paradoxical when viewed from perspective of both fat mass and fat function, like we discussed earlier कि अगर हम सिर्फ BMI को ना छोड़ के fat function and fat mass को देखें, then overall it increases the answer of morbidity and mortality. So ultimately coming कि हम लोग weight management में करते कैसे हैं, evaluation and diagnosis. So anybody who's coming with an unhealthy weight, whether it be undernutrition, lower weight, lower body weight, या high BMI, या overweight या obesity जैसे कि हमने mention किया. So we will first take a detailed history जिसमें आपकी medical history आती है. As I mentioned, family history is very important. Your sleep habits, eating patterns, your cultural history is very, very important. फिर हम आपकी डिटेल लेते हैं न्यूट्रिशनल हिस्ट्री में, यानी कि आप कितने मील्स कर रहे हो, कितने स्नैक्स ले रहे हो, आपका बिहेवियर्स क्या है, आपके ट्रिगर्स क्या है, whether you binge eat or not, whether you're night snacking, whether you're standing up in front of the fridge and opening it at 2 a.m. So these are all detailed nutritional history. Then physical activity and physical exam होता है. In certain cases, we do require lab tests. So these are the common lab tests, जिसमें आएगा आपका HbA1c to mainly diagnose pre-diabetes या diabetes, फिर cholesterol, KFT, CBC, and sometimes we'll measure inflammatory markers. Thyroid profile is very, very important, and vitamin D levels also. Certain special cases we may measure your sex hormones, certain insulin levels, C-peptide, अगर different type of diabetes suspected है, cortisol tests. There's a specific test for PCOS and diagnosis. And sometimes we may require gut microbiota ki screening and genetic testings. So what is the complication and why is it important? Why are we even having this topic and discussion? Is because ultimately जो आपकी obesity है या unhealthy weight है, it will result and increases the risk of certain diseases, more so like cancers, reproductive manifestations, excuse me, जैसे कि PCOS है, infertility है, As I mentioned earlier, it can lead to psychiatric manifestations, especially in young adults with social media these days. Then it can lead to pre-diabetes, type 2 diabetes, high BP, and ultimately, जैसे हमने fatty liver, gout, gallstones, ये सब mention किया था. So when person comes in the weight management program, what are the main goals of this program? So सबसे पहले we'll decide कि what is an unhealthy weight and the outcome कि उसको improve patient health करनी है and quality of life करनी है and overall body weight and composition करनी है improve. Now, how does this happen? This definitely happens with the changes of nutrition that you're taking, with physical activity as recommended for age and certain diseases. Behavior therapy is a very important prong of this entire treatment. Pharmacotherapy, certain times you may require drugs to address underlying diseases, and in very rare cases or extreme cases, bariatric surgeries bhi hoti hai. But overall, the treatment includes treat any underlying diseases. क्योंकि बहुत लोग जैसे हाइपोथायरॉइड होते हैं, अगर आप उनका थायराइड कंट्रोल कर सकते हो तो दैट कैन लीड टू ट्रीटमेंट ऑफ मोस्ट ऑफ योर ओवरवेट. सिमिलरली फॉर हाइपरथायरॉइड, दैट्स जस्ट एन एग्जांपल देयर. फिर आपका आता है न्यूट्रिशनल थेरेपी, विच इज मेनली नॉट जस्ट इंडिविजुअलाइज बेस्ड बट ऑल्सो एज अ फैमिली व्हाट यू ईटिंग, आपके फाइनेंशियल रिस्ट्रेंट्स क्या है, आपकी डेली लाइफस्टाइल क्या है, एंड ओवरऑल फूड एजुकेशन एंड कुकिंग हैबिट्स. Then insulin control is a very important part. Topic for another day, but insulin resistance and diabetes and obesity are all interlinked. Same thing with the drugs, certain medications जैसे कि आपको cause कर सकती है unhealthy weight, and then treatment of underlying psychiatric illnesses. Then we also include certain physical activity, which is according to the guidance, and they mainly include like dynamic training, resistive training, strength and endurance, and flexibility training, depending up on the age group ke ho and where your target goal lies. In certain cases, as mentioned, there's bariatric surgery and other technologies. So overall, just to give you a brief view how a nutrition therapy looks like, it can be divided into low calorie and very low calorie diets. जो low calorie diets है, that is something you can follow in terms of restricted fat diet, जिसमें आपका low fat and very low fat आता है. Same thing with restrictive carbohydrate diet, जिसमें low carb diet आता है. If you are following a VLCD or has been recommended, it has to be done under physician supervision only. And इसको recommend करते हैं shorter duration के लिए, anywhere from 1 to 6 months, depending again, making sure it's medically safe. And that mainly includes your meal replacements, bars and soups, which are more calorie counted and portion controlled. So overall, the treatment looks like lifestyle changes. Then certain cases, my lifestyle plus medication changes. Sometimes we do recommend medicines to address obesity directly. Then, as I mentioned, VLCD done only under a physician guidance, and then rare cases, my surgery. So a lot of my patients ask me कि हम at home या हम कहाँ से शुरू कर सकते हैं, and the common tips we give them is first and foremost to bring the need for right nutrition at a very young age. So you as parents out there can at least start educating your children and identify कि what is healthy, what is junk food. That's the first step, and you yourself knowing कि इसमें processed food क्या है, fresh food क्या है, और कैसे if possible to read nutritional labels rightly. Second, there's a lot of government undertakings happening right now, though awareness campaigns on healthy eating. Again, behavioral modification is the key to entire treatment, and adding physical activity in any form to your day, whether it's like even starting with stairs in your office or getting up and getting water at least 5 to 8 times a day. How India has been dealing with this, there's a lot of nutritional program happening. एक है पोषण अभियान के नाम से जो 2018 में launch किया था. This Food Safety and Standards Authority, which launched the Eat Right program, and this is also a global movement under WHO with different implementations of different programs. So main takeaway points: obesity or any kind of, and as I mentioned, unhealthy weight is the largest health challenge for Indians in coming years. And as I mentioned, it's not an overnight problem, it's a chronic problem. It will progress over the years because of bad food habits to begin. So, and it is a very high cost in terms of when you actually have different complications like diabetes and cardiovascular diseases. So now we'll open the session for questions. I hope this was informative to all of you.
Thanks, Dr. Mehta. I think it's better if you switch off the presentation, then we can take the viewers' questions. Thank you so much, Dr. Mikla. This was really an insightful session, and I am sure that the viewers who have watched this have taken a lot of key takeaways from here, and they're going to implement in their lifestyle as well. Some questions I've received from the viewers, and I would just like to take some 3-4 questions out of it. One important question I could see that has come up to me is that is obesity related to sleep disorder? What's your view on this, Dr. Mikla?
I think Sanjita, that's a very great question क्योंकि आजकल के सिनेरियो में हम देख रहे हैं कि sleep has become another lifestyle problem. So we don't sleep on time. We're sleeping odd hours, short hours. So क्या होता है most of the time? Externally, because you're awake, you have some night cravings and you'll be like sugar craving या आप fridge में जाओगे या कुछ order करोगे on the apps. Internally क्या होता है? Because of lack of sleep, you do have hormonal placements in there. So like I mentioned कि chronic stress hormones in turn play करते हैं. Cortisol is one of them. Another one is leptin. So these hormones do play a role, and ultimately a poor sleep will affect your health and is one of the major causes for obesity. So a good sleep hygiene is very important to know. So इसके बारे में awareness करना भी बहुत important है.
Great to know that. Second question I'm having over here from the viewers is why mostly the fat gets accumulated near to the belly? Interesting. I think people are more, they need to know more about how the body image and everything will look. So they have asked this question that why the fat is accumulated mostly near to the belly region.
Absolutely. That is, first of all, be thankful कि ये हमारी genetics है as Indian population. So if you see compared to Europeans, they won't have as much as belly fat accumulation. But हमारी जो Indian population है, we're more prone to that. And as I mentioned, कि central obesity is the term we are using for this. And for Indian population, waist to hip ratio is where the main answer is. Having said that, जो central obesity, unfortunately for us, it's definitely giving us a higher risk of developing all these diseases we talked about. So आप देखो कि अभी जो analysis हुई है, India is going to be the leading nation, unfortunately, in terms of developing diabetes and prevalence of it. And this is all coming from the visceral fat जो हमने discuss किया था कि जो fat inside the organs deposit हो रहा है and causing different inflammation and hormonal releases. This is all leading to that. So why does it accumulate there? It's because mostly of our genetics, and it is definitely the last and the least fat to get away. So when we're doing everything right, it will, but it's just we have to take it step by step in addressing that.
So that's a very important topic. I mean, point to address in your lifestyle and managing the weight. Third question which I have from a viewer here is that it's related to the emotional issues, that how can we address the emotional issues around weight loss? I mean, people think they are interrelated. So your thoughts over there.
So you're absolutely right. It is interrelated. अगर for example, जैसे हमने पहले भी mention किया कि अगर आपको emotional eating is a very huge factor, more so in females. Night eating syndrome, these are all part of emotional health. अगर कोई depressed है, unfortunately, they will have more appetite or no appetite. So these extreme variations you can see, these are all related to emotions and mental health well-being, and vice versa also. अगर आपका overweight है या you think you don't look healthy or pretty, your confidence lies down, especially in younger age females, thanks to social media. So and then that ways it's a vicious cycle. So this needs to be addressed, and that's why when we actually see patients, a very huge interview component goes in your mental and emotional well-being.
That's really insightful. The point which you said, emotions and weight loss is interrelated, and yes, people are actually influenced by social media mostly. And I mean, related to this emotional issues, I think there's one more question which has come up. It's on the stress. So, though you have highlighted, but if you can highlight more over there, that does stress contribute in increasing obesity? Like, what's your point and thought over there?
स्ट्रेस डेफिनेटली डज। जैसे हमने मेंशन किया था, एक अक्यूट स्ट्रेस होता है और एक क्रॉनिक स्ट्रेस होता है। तो आजकल के जमाने में हम सब क्रॉनिक स्ट्रेस में हमें आदत हो गई है, वे कॉन्स्टेंटली थिंकिंग अबाउट नेक्स्ट टास्क टू डू, लाइक व्हाट टू डू, वेयर टू गो। तो दिस इज लाइक वी आर नेवर रिलैक्स, सो वी हैव दिस पल्स रिलीज ऑफ स्ट्रेस हॉर्मोन्स ऑल द टाइम। एंड इफ यू हैव नोटिस्ड, एंड आई एम श्योर एवरीवन हैज नोटिस्ड, कि अगर आपको बहुत ज्यादा स्ट्रेसफुल सिचुएशन होती है, you feel craving कि मैं कुछ particular खाना खाऊं, and that makes you feel better because it will give you that short term dopamine boost. So stress plays a huge role, especially in our modern life. And it's also a part of actually demotivating या motivation में बहुत फर्क पड़ता है. So if you have to get up and exercise every day and lead a healthy lifestyle choice, then to address that stress is very, very important.
Thank you. I mean, really helpful for that. Thank you so much, Dr. Mikla, for this session. And as I already said, and I'll say it multiple times, that the viewers must have taken the key points from here, and they must have, I mean, they got the values and how to maintain their weight. And I'm sure they will, going forward, manage their lifestyles also. Thank you so much, Dr. Mikla, for joining the sessions and taking our time for us. And we thank all the viewers over here for watching this webinar. Goodbye. Take care. Stay healthy. Thank you so much. Goodbye.